Welcome to Living Chassidus. Together, let's live the Chassidus we learn.
Okay, welcome everybody to Living Chassidus. We are doing our life skills series, and a huge part of the life skills is that everyone should get to know the information that they really need to know in life now when they have time to think about it. Most girls get engaged and then life just hits and comes fast, and sometimes things happen and people get married and things happen very quickly. So within our circles, we tend to not speak about pregnancy earlier on in the stages. So now is a good time to ask all your questions, get all the knowledge, and that way you have an introduction into what's going to be Be'ezras Hashem when the time comes. So today we have the great schus of having Sara Chana Silverstein. She is one of my mentors and one of my most incredible people I look up to. I am so lucky to call her my friend. And Sara Chana Silverstein, and I'm going to do the ABC fun game, is an IBCLC RH AGH, whatever that means. She is a lactation consultant, master herbalist, and a classical homeopath. And she is also the author of the incredible book, Mutopia, which we have discussed before, and you can definitely go get it. There's Amazon and many other places. And here she is. I'll pass her on. Thank you. You want to translate all the letters?
We don't even need that. So hi, live ladies, and hi, Zoom ladies. So I definitely want to try to give you both attention. Okay, so there's a way to show it without. Here, I'll show you. 1 second. Hold on. Pause. So you should be able to share, and then if you go up here, it'll say, this is a different one. Let's go up over here. There's a way to do it.
You want to do the screen presentation?
Screen presentation, yeah.
Go to file, go on the left and go to file.
Okay. It's a little different on mine, not
Like
participants.
in the PowerPoint, yeah.
Oh,
Okay.
There should be, it should be a little safer.
Or
view.
Where's view? You can feel comfortable to come help us.
There, slideshow. Yeah,
Slideshow?
Up at the top, yeah.
here.
Yep. There we
Okay.
go.
Oh, thank you. Okay, great. All right.
Just raise you up. Right
Yeah,
there.
there you go. Okay, excellent. Okay, so this PowerPoint, thank you, Michal, for having me, and thank you for Living Chassidus to let me be part of your fabulous organization. So this PowerPoint is a PowerPoint that I do for medical professionals, and I'm going to share a bunch of slides, and this one's not going to be so much birth to newborn to toddler. We're going to do pregnancy up to birth, and then our next lecture is going to be on breastfeeding and the newborn. So let's begin. Let's see, how do we change? Yeah, it's not working. It's not working. Sometimes I have to do it a different way. Let's see, maybe this go. Okay. Is that the second one? Is
Yeah.
that the second or the third? Okay, good.
This one is there we go.
That's my next one. Okay. All right. Let me just see what we're doing. Okay, got it. Okay.
You good?
Okay. Yeah. Okay, good. All right. So as you see up here, I feel knowledge is power, and I really like everyone to gather as much information as you can get. One of the problems about looking around the internet is that anybody can write anything. You don't know who they are. And, a lot of the information about breastfeeding on the web is really presented by formula companies that are going to give you misinformation so that you will fail and use formula. Formula is a multi-billion-dollar companies are multi-billion-dollar companies. I don't want to sound like I'm the conspiracy theorist, but it's true. They give a lot of false information. So you don't know if Jeanette in Wichita, Kansas is really Joe from this formula company. So what I like people to do, what I suggest is find a couple people that you trust, stick with their knowledge, their insight, and you're going to do a lot better, because someone like Ina May Gaskin, who I consider one of my mentors. I took classes with her many, many years ago. She wrote the book Birth Matters. I don't love her breastfeeding book, but I do love her birth book. And I read it, and every pregnancy I read it. And that was really like the hashkafa, the outlook that I really had. Ina May's Guide to Childbirth is the one that I like very much. It's very succinct. It's very informational. She talks about the medical intervention. She talks about the natural approach to birthing. So I would stick with someone like that and read all of her books back to back. I love Sheila Kitchinger. Sheila Kitchinger is a woman from England. Brilliant, brilliant, brilliant. She was on the forefront of the natural birth. We don't have to discuss the whole history of pregnancy and birth, but basically people used to, back in the shtetl, only give birth at home, which we've discussed. They had no choices. Jewish women were not even allowed in hospitals. We all had our local town midwife who delivered our babies, made sure our babies had the bris on time, were our lactation consultants and our pediatricians, and a lot of them became bone setters. A bone setter is someone that would just take that bone, straighten it out, put a piece of wood under it, wrap some cotton or some burlap around it to hold the leg in place. So we always had what was called a wise woman figure that we went to. And if you were in a shtetl and didn't have a brilliant midwife, that was not great. And maybe she lost some babies, but most of our midwives of old were brilliant and they knew exactly what they were doing, and they could go out in the fields in the spring, winter, fall, pick the plants. They had plants that brought on labor. They had plants that prevented miscarriages, and and we're missing that right now. And I really think that people should find a couple people that you trust and follow their path. Aviva Ram is someone else that's fabulous. She actually is an Israeli woman, and she graduated high school, from my understanding, very young. She ended up becoming a midwife. Don't quote me. You can look her up, like when she was like 20, very young. She became a master herbalist. And after she raised her 4 children, she went back to school and became an MD. It's like what I want to do when I grow up is go back to medical school. Like, it's on my list. So she's someone that's seen it all. She's delivered babies. She's an herbalist. She's given birth to 4 babies herself, and she has now medical knowledge. So she's someone that I really, really respect and look up to also. So those are kind of the 3 top books that I would really focus in on with my pregnancies. And believe me, those 3 books, those 3 authors, you don't need anything else. You don't need anything fatty on Instagram. You don't need like the latest thing on YouTube. They've done it all. Sheila Kitchinger talks about the difference between a hospital birth and a home birth, and a home birth and a birthing center. So those are your ladies. That's all I feel you need. Okay, let's see if I can change this. Good. So pregnancy theoretically is a normal stage of life. It's normal for girls to become pre-adolescence, normal, whatever normal means in the realm of human development. They become crabby, grumpy, hard to deal with, irrational. Then they start getting their period and they become even more irrational. And then at some point, teenage girls pull it together, get married, and then it's a normal manifestation to get pregnant, right? So pregnancy is, for some people, they glow. It's like the highlight of their life. Other people, they throw up the whole 9 months. They're green or yellow, sometimes orange of their skin, and it's the most miserable time of their lives. So how we handle the rushes of hormones are all going to be very, very, very different. Some of us just feel like we're getting through those 9 months and the labor is not even as hard as the pregnancy. And other people have these beautiful pregnancies and the labor is hard. And other people have no problems during pregnancy, no problems during labor, and then they're breastfeeding a disaster. So we all get hit up somewhere. That's 100% for sure. So let's just assume pregnancy is normal. And I want to talk about drugs for nausea for a moment. So being nauseous is very, very common. I don't have the statistics up here, for a very large percentage of women. When women are nauseous during their pregnancy, they usually have what is called a fatty liver. And when the liver is fat, a little bit fatty, it doesn't mean you're a fat person. It means you've got fat deposits in your liver. You tend to have trouble converting your estrogen, and you hang on to your estrogen for a little longer than you need to, and you get nauseous. You get nauseous from the gallbladder that kicks out a bile into the stomach. And anybody that's been pregnant knows you can throw up that green, yellow bile. I hate to be gross and candid, but it's a real reality. We're going to talk a little bit about nausea, but because it's a normal part of pregnancy, the question is, how do we treat it? So you can see the drugs that are listed here. The first drug, I can't even pronounce it. Can anybody pronounce it? Thalidomide. Terrible. It created babies with severe birth defects. And it was terrible. And there were thousands and thousands, welcome, of babies born on this medication. There was another medication, I'm sorry, I don't have it listed here, where the daughters of the women that took this medicine, their cervix opened too quickly. It's about 5 years older than I am. And of course, I'm like 36, doing the math. No, anyways, slightly older than 36. And all those women needed their cervix sewn up. So I'm not a fan of medicine during pregnancy. Now we use Zofran, and we don't have any long-term clinical studies on it. So I'm a little skeptical. So let's see if my next slide is about nausea. So here we go. Nausea is normal. It doesn't mean we need medications, but it doesn't mean we don't treat it. Okay. So IV fluids during nausea, during pregnancy is my absolute favorite thing in the entire world. It can hydrate the woman. There are now services. There's services now that will come into your house and do IV fluid. And it's worth it. There's all these superstars that go out and get drunk, do too many drugs, wake up in the morning and have to be on the set to do a movie at like 8 in the morning. And they have these services that come in and give them IVs of antibiotics, IV fluids, and they pull it together very quickly. So my clients that really suffer during pregnancy, I'm a huge, gigantic fan of IV fluids. Yes.
What's in IV fluid?
Sometimes it's just sodium and water, just a bounce of salt and water. Sometimes you can get B vitamins in it. Just the fluids are very important, because what happens is when people are nauseous, they don't drink enough. When you don't drink enough, you get more nauseous. You get more nauseous, so it becomes this very vicious cycle. I'm a big advocate of B12 shots for those of you that get nauseous during pregnancy. The sublingual B12 does not do it. It's very hard to absorb B12. The reason I like it in injection is it goes right into the muscles. Our B12 is what gives us the strength to walk from here to the bathroom, from here through the snow, right? So if we're not eating enough because we're nauseous and we're dehydrated, we're certainly not eating like a red steak or, or tons of chicken. So those are kind of my two magic components of nausea during pregnancy. If you're a blood type B, if you're a person that gets nauseous easily, flying, driving, it's just one of your things, you can wake up in the morning and feel nauseous, then I would start way before you become pregnant with an herbal supplement called milk thistle. Milk thistle to me is kind of like a Brillo pad that gets rid of any fatty deposits in our liver, so our liver can convert our hormones faster. The dosage of milk thistle is 4 capsules twice a day. Seems like a lot, but milk thistle is a seed. So, excuse me, if you were making a smoothie, you just make a smoothie, you just pour flax seeds in it. You'd pour in chia seeds, nobody's measuring it. So milk thistle is also a seed of a plant. So when you open the 4 capsules of milk thistle, it's not even a tablespoon. So I would suggest taking it 6 months before you're going to get married, or even if you're dating, take it now. The only downside to milk thistle, because if you don't need it, your body will just metabolize it and get rid of it. If you do need it, it's the best thing in the world. If you're taking any medications for thyroid or psychotropic medications, milk thistle can eat up the medication. So then I would go to my next step, which is burdock root. Burdock root you can do the liquid form of milk thistle. That's liquid or tincture form. The question was, what about in liquid form? I'm a big advocate of herbs in liquid form. I'm a tincture lady. But because it's a food herb and it's a seed, I kind of like it in capsules or powder better. I think it's going to work better if we take it in food form. If anybody wants to, I would buy it online. There's a company called Frontier Herbs that you can buy a big bag of it. for like $15. You can put it in your smoothie, mix it in applesauce. So I'm going to repeat the question. So the first question was, do you take milk thistle in liquid or tincture form? And I like it better in the food form. And then the second question was, where do you buy it? So you can buy a big, huge bag of it for very little money by Frontier Herbs. You can take a tablespoon of it twice a day in a smoothie, in some applesauce. You can mix it into your oatmeal. You can mix it into your soup. It doesn't matter. And the question was also, how long do you take it? As long as you can. Milk thistle is only going to benefit us. Our liver can get congested, forget the fatty part, just from smog, dust, anxiety, stress, being overwhelmed. I don't know if anybody can relate. Like, you know what I mean? Like, who doesn't have a liver that needs support in this day and age? You know, lockdowns, COVID, like, can I go on? Like, ridiculous. So I think everybody can support their liver. In my book, Mootopia, plug for Mootopia, I have a whole chapter on the liver. So milk thistle is my first choice. If you're on, you can take it before pregnancy, during breastfeeding pregnancy, after pregnancy. Like, milk thistle is something like you can't get enough of it. If you're a blood type B or an AB, you should take it your whole life, because Bs and ABs get very nauseous during their pregnancies more than other blood types. But all blood types can benefit from it. But again, I want to stress that it can eat up medicines like birth control pill. So if you're married on the birth control pill, I would not add milk thistle right now, because it could eat it up, especially if you don't want to get pregnant because you want to support your liver before your next pregnancy. Then I would swap down to the burdock root. Burdock root is a little bit more of food for the liver as opposed to a liver cleanser, but it does help support that liver so you can feel less nauseous during your pregnancies. So if you can stomach it during your pregnancies, take it the whole pregnancy. Totally fine. Wild yam, which I mentioned there, wild yam, burdock root, again. So let me explain, just to know. I actually just did a post. If anybody wants to follow me on Instagram today, I had done a TV show on food medicine that's food. So burdock root you can eat. You can take the burdock root, you can buy it in a store. Oh gosh, like certainly not in Crown Heights, but other areas, you know, more in the Asian markets. Huh?
Like, you don't buy it in the Chinese market.
Yes, you can.
But like, it's like steams in it. Like,
I would. You peel it. You can't really make bad burdock root. You peel it, you slice it up, and you can put it in your stir fry. Or you can buy it in powdered form and mix it in with your smoothie. Or you can take it in capsule form. All these herbs, milk thistle and burdock root, you can take in capsule form. And the dosage is 4 capsules in the morning, 4 capsules in the evening. And you can buy them online. You can get milk thistle with a hechsher on it. I forget what the company's name is. Just Google milk thistle capsule. You can get kosher. And burdock root you can't with a hechsher, but if you get it vegan, vegetarian, no milk products, they're fine to take, because when it says vegan capsules, they're all the same capsule company in the US. The ones that Maxi Health, NutriSupreme, and anybody that's vegetarian or vegan, they're all using the same capsules. So milk thistle will definitely cleanse the liver, get it prepared for pregnancy. Burdock root will support the liver. Can you take them both at the same time? Of course you can. In your smoothie in the morning, you can put some milk thistle and burdock root. In the evening, when you have a cup of chicken soup, you can put some burdock seed, and you can put some burdock root right in and mix it up. It'll dissolve.
4 times a day.
Twice a day. So the capsules for milk thistle, theoretically, I can't diagnose through Zoom or in a classroom, but the typical dose is 4 capsules at night and 4 capsules in the morning. That's typical for the average woman. Burdock root, you can get away with 2 capsules in the morning or 2 capsules in the evening, twice a day. So it depends on what you're doing. And now one thing about milk thistle and burdock root, you can take it for a week, forget about it for a week just because life happens, remember and take it again, forget for 3 days, you go away for Shabbos, you forgot your milk thistle. These herbs, it's the long-term effect of taking it. So if you miss a day or 2, it's fine. Does that make sense? Think of these as support for that liver so you aren't so nauseous during your pregnancy. Wild yam, with food, without food, whatever. So our liver, which I talk about in my book Mootopia, has two functions. It's one of the only organs that have two different functions. It functions one way at night and one way during the day. It actually switches. It's like, this is the night function, detoxifying the body, although I don't like to think of us as being toxic. I would just say kind of reboot the system. Then during the day, it helps us deal with our emotional stress and our Uber driver that's mean to us, and our dry cleaner that accidentally lost my dress that I'm wearing to L'chaim tonight. Those kind of like daily stresses, right? So it has two functions. So that's why we like to take it at night, the milk thistle, with dinner, and then again in the morning. So it supports both functions of the liver. Okay. Wild yam is an herb that I haven't had that much success with, but it's in the literature, so I discuss it. I use wild yam a lot with wild yam with women that have chronic miscarriages. I'll use wild yam. It helps with pain, and it's actually what our first birth controls were made from, was yam from South America. So it's got some hormonal component to it. I've never seen it help with morning sickness so much, but I use it a lot in my fertility or chronic miscarriage herbs. There are homeopathic remedies that help a lot with nausea during pregnancy. And I mentioned them here: carbolic acid, lactic acid, symphoricarp, tabascum. I'll run through what they are very quickly. Yes, they're carbolic acid, lactic acid. Can you see them there? Symphoric, sure, of course. And tabascum. We just have it going live here in our live with our live audience. Okay, so homeopathic remedies are the little ballies that you dissolve under your tongue. Does everybody hear about arnica or hypericum? You take the ballies, you dissolve it under your tongue. In my experience of over 30 years of working with pregnant moms, moms with miscarriages, breastfeeding moms, for nausea, I find homeopathy to work the best. Milk thistle and burdock root is just your foundation. But for the actual nausea, carbolic acid is, if you get a lot of saliva, a lot of women when they're pregnant, they get a lot of saliva, they have to spit a lot. It's too nauseating to swallow it if you're nauseous. It's like, really, what is this coming from? A lot of indigestion and a lot of reflux. Carbolic acid. Lactic acid is my go-to. It's just, I'm nauseous morning, noon, and night. Symphoricarp are the women that just cannot get out of bed. And tabascum is when every smell makes me crazy. My husband walks from the street, putting his key in the door, and I can already smell him. That's a pregnant woman that's having a problem with nausea. My kids walk in the room. My kids would have to, I suffer from nausea. They would have to like stand by the bedroom door to speak to me because I could smell their breath from the door. And my kids obsessively brush their teeth, right? So that's a different kind of nausea. So hypermesis is a condition where women throw up 24/7. And then there's light nausea where you're just a little nauseous. You're just a little nauseous in the morning or throughout the day. On a scale of 1 to 10, 10 is the worst. Some women are going to get it not at all. Some women are going to get it at 1, 2, 3, 4, and some women are going to get it up into 10. But again, I'm not thrilled with the medications out there. We see long-term struggles with it. Okay, let's go on. Say it again, please. So we here in Crown Heights have a woman named Hannah Bongart who sells Parav ones. So we in most of the Frum communities have Parav homeopathic remedies. The ones you buy online have a little dairy in it, but less than 1/60th. So the Rabbanim say if you're on shlichus or living out of town and you need a homeopathic remedy because it's got because it's for medicine and it's less than 1/60th of a lactose sugar, you can use it. But hydroxychloroquine, which is a phenomenal medication, by the way, in the beginning stages of, I'm not going to mention the name of the illness, but it's got some dairy in it, but you're okay to take it. And a lot of our medicines, even our Prevacid, very often have a little bit of a dairy base. So once we're taking it for medicine, it's completely bittel because it's usually less than 1/60th. Okay. So any other questions about nausea? during pregnancy? You in the chat box, you guys can write questions and we'll at the end go through them. Okay. All right. So when
One thing you were saying
Sure.
about, you get any vitamin online as long, or where, from wherever, even without a kosher symbol, as long as it's vegan.
the herbs, I can talk more for the herbs. Like when you're taking an herb, it usually says milk thistle vegetarian capsule. It's not complicated. When you get a tincture, it will say tincture is the liquid herb. It'll say milk thistle, grain alcohol, water. When you're getting into vitamins, there's always like 70 ingredients. So there's a lot more shilas and a lot more questions on that. But when we're talking about herbs, we've discussed this before. You take an herb like this. This happens to be elderflower. You pour grain alcohol over it. You let it sit for 6 to 8 weeks. And then you get like this in a glass jar. And then you tincture it and you get an herb that looks like this. There's momish like 3 ingredients and very often only 2 ingredients. Do you understand what I'm saying? So that I can vouch for a lot more than those vitamins. They've got citric acid, they've got artificial coloring, they've got natural coloring, they've got preservatives, they've got so many things in it that really is a lot more of a problem than herbs. Hence why I like herbs better.
What about the alcohol?
So in the United States right now, the question was for all you Zoom listeners, what about the alcohol? So 99% of the herbal companies all use the same grain alcohol that has a hechsher on it. It's a cane alcohol. It used to be made way back when from grapes. So we had all kinds of shilas. Then it was made from corn, which we had less, but the Rabbanim actually allowed, again, you have to speak to your Rav, for a lot of my clients that were experiencing miscarriages or nausea during pregnancy to take it even during Pesach, because it was kidney, it's not chometz. But now it's made from a sugar cane. So it's usually not a problem. Okay. Yes.
Both herbs and tinctures.
Less of a problem. I mean, I'm not a Rav, but I speak to Rabbanim all the time. When you get a dried herb like this, 99.9% of the time, there's nothing but a dried herb on it. Herbalists are such purists. They don't want, I mean, sunlight. They'll let sunlight be on it. Do you know what I mean? Like someone that washed their hands can like pick the plant. They're pretty OCD about that. Herbalists just want the plant. So you can find out. So the companies I use are Herbalist and Alchemist. He's from New Jersey. He's not getting any of his plants from China. And when you use reliable herbal companies, they have chemists right on the plant, checking the plants. They check for lead and they check for pesticides, because herbalists are not great business people. They're really like sincere about their plants. You know what I'm saying? It's just the way that it is. And when you get a plant like this or even milk thistle, there's going to be nothing but milk thistle in it. You know what I'm saying? Like nothing. Okay. So those are, yeah. So the milk thistle that comes in seeds is, that question is, what does the milk thistle looks like? It's ground. So it's like a ground flax seed. Have you ever seen ground flax seeds? Comes in this powdery form. Not the best tasting, but if you put it in a smoothie, you'll never taste it. You mix it in your soup, you're never going to taste it. Okay. It's easiest for my ladies in vegetarian capsules, because you just take your capsules, boom, out the door. But you can save a lot of money by buying a big, huge bag of it. Okay. So when you're pregnant, you want it in capsules or in bulk. In the powder, there's a company I buy it on Amazon from Frontier Herbs. The capsules I get from a company called Eclectic, however you spell eclectic, like it sounds. They don't have a hechsher on it, but it's vegan, vegetarian. They have a big sign that says kosher, but it's not like an OU or an OK. All right. All right. So that's great. So that's about the herbs. So when you're pregnant, you have a lot more blood. You have 50% more blood. So if I had this much blood in my system, when you're pregnant, you have double the amount of blood. Okay. So why am I even bringing that up? Because you can feel heavier. You're going to feel more swollen. And that heart has to work harder to pump that blood from your feet all the way up to your brain, which is very important so that we don't have as much brain fog as we do. And our veins, which we're going to talk about, our veins, which are usually this thin need to become this thick. And then they need to pump the blood. So the veins are fatter and they need to pump the blood through the body. So blood is very important. Blood gives us life. When you're pregnant, the baby is fed through the placenta. Guess what food the baby gets through the placenta? Blood. Blood creates our body. And then when it comes to breastfeeding, Hashem says that Hashem made a chesed and turned the breast milk from red to white so women are not repulsed by breastfeeding their babies. So breast milk is white blood. And inside the womb, the baby's getting blood. So we are having double the amount of blood in our body to feed the baby and feed ourselves, feed the baby and feed ourselves. So we'll still, Michal, we have to have another talk about blood typing. We never did that. But I know that A's are different than O's, O's are different than B's, B's are different than AB's, because Hashem's the one that made the 4 blood types, not me. I would have just made everybody the same, make life easy. I would give birth by unzipping a zipper, like let's make life really easy. So the 4 blood types are very different, but it's very important to, when you eat, you're feeding your blood. You're giving nutrients to your blood. Blood is what gives us chayas. So I just wanted to explain that your blood volume really changes when you're pregnant. A lot of my clients will feel more congestion and stuffiness in their sinuses. People will get varicose veins. People can get more fluid in their ears when they're pregnant because we are double the amount of blood flow. Okay, let's see.
How does the sinuses relate to the blood?
Because we've got blood flowing through our sinuses. So there's just more volume going through everything.
Some people's skin gets better. Isn't the fluid in the sinus is different?
It is different, but most of it has a blood base to it. Mhm. Says blood volume increases significantly within the first few weeks of gestation and increases progressively throughout the entire pregnancy. The total blood volume increase varies from 20% to 100% above pre-pregnancy levels, up to almost 50% more. Okay, let's go on. So back to blood. Very often women get anemic. They have low iron during their pregnancies. Then build it up now. Start building up your blood volume now. Start building up your iron levels now. Okay, so anemia is a very common problem in pregnancy, can make you more nauseous, can make you exhausted, can make you grumpy and kvetchy, and can make it even more difficult. So if you're low iron now, work on it. Problems with the iron pills that your doctors prescribes are they're very, very constipating. So up there, you can see on the slide, I have a product called Floridex. It's not my product, but I really love it. Floridex is an amazing way to build up your iron. You can take it now. You can take either a capful in the morning or the morning and evening. And remember, whenever we're talking about anemic levels, I'm just making up numbers. Let's say the numbers are between 30 and 60. If you're at 31, your midwife might tell you you're within the normal range, but you may need to be up to 60 to have the koyach or the strength that you need. Floridex, sometimes some Rabbanim say there's a shaila with it because it is in a grape alcohol. Here we go. They haven't changed their recipe yet, but most Rabbanim allow you to put it in some grape juice and then it makes it bottle and you're allowed to take it. It's the best product I've seen out there. The next favorite thing I do is called blackstrap molasses. On my website, I do have a recipe, sarachana.com or moodtopiabook.com. Blackstrap molasses is called poor man's iron. It is phenomenal. And most of my pregnant ladies have a cup of it in the morning. I'll just tell you the recipe very quickly. You take a tablespoon of blackstrap molasses, put it in a cup, put a tablespoon of honey, depending on how sweet you want it, pour some boiling water over it, make it into a fake coffee, and you can add some almond milk or rice milk to it. It is a phenomenal booster of iron without constipation. Very high in potassium. It's also got B vitamins in it. It's a phenomenal way to get vitamins and nutrients into your body. My ladies that know they get anemic during their pregnancies right away start drinking it the second they know they're pregnant.
How does it compare with the Floridex?
It's different. You could do both and you won't get too much iron. It's great. I mean, I just love it. It depends on what the numbers are and how not well the person's feeling. But my kids, you can call them up and give you their numbers. Whenever they were home sick, I would make them a cup of blackstrap molasses. That was what they had. They'd have it by their bed. That was what they drank all the time. And they were just used to drinking blackstrap molasses. And they learned to love it. You have to make the combination. It's a little bit bitter. So molasses is actually the outer layer of sugar. And you're like, oh my gosh, isn't sugar so unhealthy? Well, it's not when you've got that coating around it. That coating is so high in vitamins and nutrients. We also know that kids love sugar. Most adults love sugar, and breast milk, which we're going to learn in our next lecture, is like 85 to 90% sugar. So even though we're supposed to like stay away from the white sugar, the brown part of the sugar, which turns into molasses, is actually one of the healthiest things that I've ever found for anemia. So if I have a woman that's having a home birth and she just forgot about everything because she's just like in her zone, and all of a sudden she's so anemic that her midwife says, well, you can't give birth at home, because there is a chance, there's a risk of hemorrhage if your iron levels are too low. And she'll go, Sara Chana, what do I do? I've got 2 weeks. You're going to have your blackstrap molasses in the morning with your Floridex. Take your Floridex in the afternoon, and then you're going to juice beets, any kind of greens and carrots. And within a week, your iron levels will rise. It's unbelievable how quickly they rise.
That's how often you have to take it.
It depends on how, it depends on,
I just be checking by a doctor.
or your midwife. Yeah, for sure. You know, it depends, but I'm telling you, my clients will just forget everything. They did so many classes, they know everything and just forgot everything. The next thing you know, they're lying in bed. They're so anemic, they can barely get out of bed. I'm just saying the numbers in my experience rise so beautifully, much better than the pills that they give. That's my experience. Yes. Question.
If you put molasses, let's say in like a cookie, but there's a substantial amount, will it have the same effect as if you use it?
Yeah, it's good. Yeah, it's good. You can do it that way also. Yeah, I just really, yes, oatmeal's a great idea. In your smoothie is a great idea for sure. I mean, the cookies, you know, got a little brown sugar in there, a little chocolate, a little oatmeal. Yeah, no, there's no problem. Of course you can. Of course you can. But smoothie, anytime you can add molasses into your life, it's really helpful.
Where do you buy it?
You can get it at any health food store or online, all the stores on Kingston. Huh? Yeah, it's raw. That's the company I like best from Wholesome Foods. And I don't represent that company. I just happen to, because when I teach at medical schools, I have to say, I'm not part of that company. But that's one I find tastes the best, by the way, just in my experience with my clients. Ferrum Phos is a homeopathic remedy that can help you hang on to your iron also. So sometimes when women are pregnant, they can even take higher iron levels of iron and they just urinate it out. And Ferrum Phos is a homeopathic remedy you can also take. So I'm just giving you guys some tools of how to deal with anemia during pregnancy, because you go to your doctor, your midwife, they're just going to hand you this bottle of iron, which may bring the levels up halfway, but then you're so constipated, then we have to deal with a whole different thing of constipation. So everything I'm talking about on this page will not make you constipated. It's really nice not to be constipated when you're pregnant, by the way. Was there a question? I'm not worried about it really getting too high. There are people that have conditions where their iron levels get too high and they really need to do bloodletting. They need to donate blood and then their levels get more regulated. There are Ashkenazi Jews that do have this problem with too high iron levels, but they know it way before they're pregnant. And the cure, we can look up the symptoms of high iron, but they know very quickly. And the cure to that is just old-fashioned bloodletting, although we don't just do it now, you know, cut them and let them bleed out. You go and you donate blood and everyone's really happy to get your blood. Yeah, there's a whole thing when we're talking about blood. So we as human beings have not been able to create an artificial blood yet. And when we do blood typing, we'll talk about it because it's very fascinating. The question is, our blood banks are low and we need to donate blood as often as we can. So if Beaker Cholim comes in town and you're not pregnant, donate blood. Have your husbands donate blood and have your kids donate blood. Blood banking is very, very important. And if you ever have a loved one that needs blood, there's separate Jewish blood banking, and it's the best thing in the entire world. So I'm a big advocate of donating blood whenever you can. That's a big thing for me. Yes, question. You can get it on Kingston at Apple Drugs or Sunshine, or you can order it online. Okay. All right. Let's go on. So let's see if we can. Okay, let's go here. So I just want to talk about bleeding. Again, we're on our blood talk. So it's normal to sometimes stain. If we go back a slide, hold on, let me see if I can go back a slide. Where is this? So I didn't mention this, but now I'm going to mention, we'll go back. It says light bleeding or spotting during pregnancy is common, especially during the first trimester. And that happens to a lot of women. And that's sometimes one of the first signs that they know that they're pregnant. It does put you in NIDA, but it is very common. It doesn't mean you're having a miscarriage. If you start to bleed during your pregnancy, usually we leave it alone and we don't do anything. And if it's going to be a miscarriage, it's just hashgacha pratis and it's a miscarriage and you move on. But sometimes my clients will have a hematoma or a blood clot, or they can have a polyp that starts bleeding. So then we, as an herbalist, can use herbs like shepherd's purse and yarrow. Usually my clients that stain a lot during their pregnancies are anemic, and all we have to do is increase their iron and they stop staining. Partridge berry is an herb that we give a lot if a woman's prone to miscarriages. But in my experience of 30 years, I have found, I mean, obviously a lot of miscarriages are due to genetic disorders in babies, but very often it's a blood clotting problem. As Ashkenazi Jews, we have a lot of what is called, oh my gosh, brain fog, factor 5. We have factor 5, factor 10. These are different blood conditions that can treat chronic miscarriages. So it's normal in a course of, if someone's pregnant 10 times, they're probably going to have an average of 2 miscarriages. If you have 5 babies, it's normal to have at least 1 or 2 miscarriages. So miscarriages are not abnormal in the realm of your life as being a pregnant woman. But if you get one, I'm a big advocate, of immediately running and doing testing to see if you're factor 5, checking those iron levels, because they don't usually do checking until you've had like 3 miscarriages. And at that point, I'm like, let's go quickly. So there is a medicine called Lovenox, which is a blood thinner. And although I'm an herbalist, I'm a big fan of my clients that have had miscarriages to take Lovenox. Lovenox is a blood thinner. But we also use things like vitamin E and different herbs if you tend. So I'd say from my experience, and I'm not an MD, 9 out of 10 people that miscarry are because of blood clots. And we can see them a lot on their cervixes and other places. Yes, go ahead. Factor 5 is a genetic condition. A lot of intermarriage, we married our cousins, our first cousins, our second cousins, we stay in our own little shtetl. And factor 5 is a problem that can cause bleeding disorders. So a lot of women with factor 5 cannot take epidurals, because their risk of hemorrhage is too high. And other women with factor 5 get all these little weird blood clots. So, well, usually, I mean, again, I'm like, let's figure this out kind of a person. It's usually after you've had 3 miscarriages and these women have lost their mind. They come to me for herbs because they're really emotionally, off their rockers, and no one's done genetic testing. So if you have one miscarriage, you're in the realm of everybody else. You're having 2 miscarriages, I would say go straight to a hematologist and get all the testing for genetic disorders, because if you know you have factor 5, then right away there's medications you can take to avoid that miscarriage. Yes.
If there's an issue with epidurals, why aren't they checking women when they're pregnant? Like, what if you didn't have a miscarriage if you had factor 5? Wouldn't that be really dangerous?
Yeah.
So they just don't care?
Right. Yeah. I mean, I've had women that have had 2 or 3 stillborns where they give birth, Rahmana, to a 6-month baby or a 5-month baby, and they haven't sent them to a hematologist. So I think it's a little more common in the Ashkenazi world. I mean, I don't have the statistics up here. We could look them up, but I'm a big advocate of just like, you have insurance, just go to a hematologist, get the gamut of tests. Like, why not? You know, I'm a big advocate of using Western medicine to benefit my herbal practice. You know, someone go get a CAT scan, go get a sonogram, go get an MRI. I'm the happiest person in the world. I'm not against allopathic conventional medicine. I like to combine them both together. So any testing I can get. I've just seen a lot more factor V over the last 20 years than I ever expected. And I think it's just more common than we think in our neighborhoods. That's what I think. Yes.
Going back to you're talking about when you were talking about staining, and you said
Yeah.
some staining is like a little bit of staining is normal.
Yes.
In pregnancy, when does it become a concern? Like, when should someone go, ooh, this might be hemorrhaging or something like that?
Right. Well, if you start soaking a pad and you're pregnant, you go right away to your midwife or OB or emergency room. If you're just having light staining, then we can usually figure out what it is. So light staining is very different than heavy bleeding. Like, I have some women that until they get their iron levels up, they're just staining all the time during their pregnancies. So if you're bleeding, if you're going through a pad, you need to go get some help when you're pregnant.
And for the light staining, is it recommended to just leave it alone or to do this?
I like to know what it is, and then we can figure it out. Like, I'm going to check her B12 levels. I'm going to check her iron levels. If I suspect factor V, I'm going to just beg that she goes to a hematologist. It's not a complex test, just ordering a blood test. So and then I want her to go and see if she has a polyp on her cervix, or does she have a hematoma, which is a blood clot. Like, I'm like, what are we waiting for? You know what I mean? I'm kind. Sure. I mean, I don't know. Why not? You know, you can always like say like, I believe there's some factor V in my family. You know, I want to just do some research. I mean, I think it should be standard for Ashkenazi Jews. My son's going to medical school, and he says like the Dari Sharm's just not testing enough for what's out there. There's something called J screen, which is much more accurate at this point. So personally, I think why not? I would check your fibrinogen levels. Your fibrinogen levels is your ability to clot or overclot or underclot. I would check factor V. Even though I'm an herbalist, oh my gosh, I would take many more tests than people take. Yeah, why not know ahead of time? Why not? That's my philosophy on that. So if we have bleeding or staining, or a history of miscarriage, we would do some partridge berry during the pregnancy. The homeopathic remedies I like is a remedy called Sabina for women. It's just common. Some women just stain and their iron levels are fine and they don't have factor V. And silica, I've seen miracles of hematomas, which are blood clots on the cervix. And like, if anybody didn't believe in homeopathy, like, you have to like, you'll be instantly convinced, because these doctors say this hematoma can cause a miscarriage. It's going to be there throughout the whole pregnancy. We do a couple weeks of silica and it's like gone. And the doctor's like, I don't know what happened, miracles. And we're like, the homeopathic remedy. So I really like that. Okay. So herbs for, what time is it now? 9 o'clock. Okay. Herbs for UTI, pregnancy, postpartum. UTIs are very common during pregnancy. Urinary tract infections, UTIs, thank you. We get them a lot, excuse me, postpartum, especially if you get an epidural. They're going to take, when you get an epidural, they take a catheter, they put it inside your bladder through your urethra. And about 80% of women that get epidurals end up getting urinary tract infections within 2 to 6 weeks postpartum. So the epidurals are a little more intense than we think, but that is a problem. Another problem I have is getting Brazilian waxes. So I'm like, you know, that older lady that's supposed to say, oh my gosh, don't talk about Brazilian waxes. Like my kids, like, Ma, you can't talk about it. So the way Hashem created our bodies is we're supposed to have hair on our private area. And the hair on our private area actually is a filter. So when we're intimate with our husband, it kind of catches any dirt or schmutz that could be going on. And it's very, very important to have hair in your private area. And a lot of my clients that have chronic UTIs, I'm like, forget the Brazilian wax. Sara Chana, everybody does it. I'm like, well, for you, it's causing urinary tract infections. Maybe it's not for your friends. but the makeup of the hair of a woman and a man are completely different. And there's a whole book on it that I think women's hairs are more curly and men's are more straight. And the way they meet together actually protects the pelvic bone for the woman, and that it helps prevent UTIs. It's like this whole science of why it's there. So we don't want to get rid of that. It's really important to be there. Also, if you're using any not contraceptive creams, but gels for intimacy, like what are they called? The glide, slide, water, slippery, whatever they're called. They can also lubricant. Thank you. I was looking for the word. I'm like, oh gosh, what's the real word, Sara Chana? You can clog the urethra. Urethra is a little hole that we have where we urinate through in our vaginal canal. If you look at any of the lubricants, you take the cap off, there's like a little goopy stuff. Well, that goopy stuff can get stuck on the urethra and you can get UTIs because of that. So there's other more natural ways, which I think we talk about. Cocoa butter is actually very good. I'm not a big coconut fan because it's actually the coconut butter in the stick, and it works very, very well. Better, and it does not thicken and goop up like the lubricants. Thank you for that word. So constipation is a big problem during pregnancy. A lot of women will, because you've got this big bladder, you've got this big baby in this womb that's sitting on top of your bladder, and then your bladder is pushing into your intestines, and you can get constipated. So I like my clients not to be constipated. That's kind of a very important thing for me. Carrot juice works wonders. Carrot juice is just fabulous. I also like ground flax seeds mixed with pear sauce. Apples are binding, pears are relaxing. So if kids have diarrhea, you give them apples or applesauce. And if someone's constipated, we do pear juice or pear sauce. I don't know why we can't get the big pear sauces like normal, like applesauce. Maybe one of you can be an entrepreneur and make it. But I get the little baby pear sauces, squeeze it into a cup, add some flax seeds, and boom, there we go. You can buy them ground. I mean, I'm a little lazy. I mean, I try to get everything pre-made as much as I can. You can make an old-fashioned compost where you have blueberries, peaches smashed. That works really well. Just cook that, pretend like you're an old bubby, keep it in the fridge, and that works really well. Here's some herbs: licorice, slippery elm bark, marshmallow nettles. And these are herbs that really help with constipation, but you don't want to be constipated, especially before you go into labor. Before you go into labor, you want those stools, because most women make a bowel movement in the middle of delivery, which is like so mortifying. You're like, you have your nails done, you have a little mascara on, you've got a cute little outfit on, you're trying to be so classy. You make a bowel movement when you're delivered. It's like really mortifying, but everyone does it. It's just natural. But if you try to soften up your stools before you give birth, it's a little bit more pleasant. Okay. All right. So say it again. For sure. Of course. Or it's, you need a juicer. You take a juicer, put the carrots in, smash, and you get this lovely golden, delicious. Yeah.
Can you just eat carrots or cook carrots? It's the same thing?
Yeah, but like if you get carrot juice, it's like 18 carrots and this much juice. So for you to eat 18 carrots, it's like way too much chewing and swallowing, in my opinion. Right. So hemorrhoids. Yes. Yes. The question for you Zoom ladies is, how important is if the vegetables are organic? I mean, if you can afford it, great. Do you know what I mean? So with me, there's certain vegetables that I really try to get organic, like peaches are better. Organic is very thin skinned. Potatoes, I don't care about as much. Carrots, if I'm juicing, I'd rather it be organic. You kind of have to weigh. Like onions, I don't mind as much. I mean, there's people out there going, oh my gosh, Sara Chana is crazy. Depends on what your budget is. Do you know what I'm saying? Like I only eat organic eggs because I feel it's better the way they treat the chickens. I feel it's better. So you have to weigh what you can afford and what you can find. Make sense? It's still good for you. Yeah, it's still good for you. It's better than not. And if you have constipation, your organic or non-organic is going to work exactly the same in your intestines. Cooked are better for constipation. Oh, either the juice raw or carrots cooked. But again, we were talking about chewing and swallowing. You could cook up some carrots, smash them, and eat tablespoons of it a lot easier than chewing 18 carrots. Okay. So I make a fabulous essential oil mix for hemorrhoids. Hemorrhoids are a big problem for women when they're pregnant. What happens is your stools are a little too hard. You want your stools to be really soft when you're pregnant. That's eating a lot of vegetables. If you can't eat vegetables, juice them. If you can't juice them, eat cooked fruits, but try to keep your stools as soft as possible during pregnancy. Otherwise, you can get these hemorrhoids. You can get hemorrhoids not being pregnant. It's similar to a varicose vein.
I would just clarify what hemorrhoids are.
Oh, hemorrhoids are, okay, well, we have that picture there. So hemorrhoids are kind of a congestion of blood in a vein that swells and gets purple. And, it's hard to have them go away. They do. I have this oil that's actually like really great for it. They have witch hazel pads that can shrink it. Usually once a varicose vein in the tush hemorrhoid, it'll come and go throughout your life. So the best thing to do is try to avoid them. But some people have more of a propensity towards it. It can run in families. Huh?
How do you avoid it?
Keeping your stool soft. Don't push so hard. Make sure you've got a lot of vegetables in your diet. And eat for your blood type, which we're going to do.
Proper sitting.
Proper sitting.
Don't push so hard.
Don't
Proper
push so hard. Yeah, there's these potties, squatty potties that, you know, yeah, you can do a squatty potty if you don't have a prolapsed uterus for sure. There's a lot of things you can do. Okay, here's our varicose veins, which I was discussing. So varicose veins are, and I'm going to explain this to you. We have to look a little bit at a time, Michal, but we're okay. So varicose veins are, remember I told you, double the amount of blood flow. So your veins need to stretch. And then once the veins have stretched from the double amount of blood in your body, watch what they have to do. Watch my hands. They do a peristaltic or wave-like motion. So a varicose vein is when the vein stretches out and doesn't go back to its proper shape. The veins need to stretch and move. Stretch and move, and you get a varicose vein when they stretch and they just never go back to their place. It's like a pair of nylons that you've worn too many times and you can see the knees and ankles in them. We don't want that. We want our veins to be able to stretch and go back. Berries, berries, and berries. Blueberries, strawberries, blackberries, cranberries. Berries help with varicose veins. They build the lining of the walls. Very, very important. Exercises, I mean, I have a trampoline in my house, one of those little trampolines. It's called a Bellicon. And I try to bounce on my Bellicon. I try to every night. A 10-minute workout on your Bellicon is like a 30-minute run. Jumping on trampolines, doing inversions in yoga. Even if you're just sitting down, just taking your foot like this and circling it, making sure you're moving, stretching out. Very important to keep your veins moving the blood at all times. Don't be a couch potato if you don't want varicose veins. This is one of the most common complaints of pregnancies is varicose veins. And I would work on my veins before I'm pregnant. Make sure you're doing yoga inversions. Make sure you're moving all the time, moving your arms, moving your legs. Let that blood be used to flowing in the body and not being stagnant. In Chinese medicine, it would be called stagnant blood. Michal, because it's already 10 after 9, can we see if there's any questions? And I think we're going to have to end it at that. But I want to show you guys very important because I want to jump to this one slide, which we don't have time for today. Doesn't mean we can't. So here I wanted to talk about some uterine toner herbs. This is the slide I really wanted to show everybody. So I found this gorgeous, let me show our Zoomers, this gorgeous teapot. How lovely is that? And I have a travel one like this. Have I brought these before?
I love it.
Gorgeous. They're gorgeous and they're easy. And what you do is you just unscrew this, put your herbs in here, add some honey or any sweetener you want, put hot boiling water, and you have your herbs that you can travel anywhere you want with. Unbelievable. Erev Shabbos, I will make a wonderful new tea combination for my family. Every week it's a different combination, trying to treat every ailment they have, like insanity, craziness, being pushy, going to bed too late, you know, all those kinds of conditions. And I will go like this. This is a beautiful little tea filter. And I love it. And so you can get these now. They're very inexpensive on Amazon. My favorite uterine toner is strawberry leaf.
What do you mean by uterine?
It means it strengthens the uterus. It helps our veins. It's good for our female organs. It has no hormones in it. Strawberry leaf. Red raspberry leaf is the popular one that everybody talks about. Everyone's into red raspberry leaf. It's a very drying herb. So if you have dry skin, dry hands, red raspberry is going to dry you out too much. We use red raspberry if you have a cold, to dry up your sinuses, to dry up your drippy nose. You do not want to use too many drying herbs when you're pregnant. You want to stay moist and supple, right? So I think strawberry leaf's a better supplement for that. I love, no, not the dried herbs. Nettles.
Strawberry teas, like the regular strawberry teas, are those good enough?
No, I want strawberry leaf. I want you to buy it in bulk, strawberry leaf. Huh? No, because it's dried.
What if you buy the one that's in the pharmacy, like, okay, red raspberry, nettle?
If you can find it there,
Yeah, they do.
they have it in bulk.
It's in all, in little bags.
It's so much cheaper to buy it in a big bag, but you can use those. So if you're going to use tea bags, you have to put like 4 tea bags per cup. Because if you don't have 4 tea bags, then you're just flavoring the water. If you have 4 tea bags, you're getting medicine. Okay. Nettles is my absolute favorite herb for pregnancy. Not even a question about that. It's got more vitamins, sugars, and nutrients in nettles than any other plant on the planet. So if you're nauseous and you're not eating a lot of vegetables, you're not eating a lot of salads, nettles is what's great. And shatavari is another green herb. They use it in India all the time. And it's got all these trace minerals and vitamins, and it's very moistening and softening for the body. So a lot of my clients will feel like their nasal passages are dry when they're pregnant. Their throat can get dry. Their skin can get dry.
That's a shatavari.
Yeah.
Can you use that in the winter when you feel dry?
Yeah, for sure. It's something to add to this. So anyways, we're going to open up to questions. I'm actually doing a radio show and have to get home. I'm so sorry. Conflict. I really thought it was 10 o'clock New York time and it's 9:45. So we're going to answer some questions that we have on the chat. Michal, you want to bop in there? I want to thank you, ladies. You're going to listen to the questions and answers. Thank you for coming out in the cold winter, snow. I don't know where people are out there. They're like laughing. They're like, oh, I'm in Florida. I'm in California. But here it's pretty snowy and icy. Yes.
Okay, so we have HD.
And we have our our hipster girl with us today. Thank you so much for joining us. Follow her on Instagram. I love watching her stories. Okay, yes.
Okay. HD is really bad. Do you find that these help?
Yes, and I find if you have hypermesis, it's worth having a consult with me because I really help people. This is not a pitch for me. This is a pitch for you, but I help a lot with hypermesis. Next question.
What is the difference between iron and ferritin?
You'll have to look that up online to get a good definition of that.
Here's the link to the
Great. Oh, thank you for giving that link. I love that. Yes.
What do you think about iron?
I think iron infusions are really important if you need it, no question about that. But I would like to start with easier ways, and I think that if my ladies start pretty quickly with the iron, you can sometimes avoid that unless you have a condition.
Okay. Besides the testing factors by
Fibrinogen levels.
what are the tests?
I would go to a hematologist and say, hey, I'm an Ashkenazi Jew. Before you ladies leave, I want to thank you for coming and thank Michal and Living Chassidus for this fabulous evening. Thank you so much.
Same time, same place.
Amazing. Okay, is there anything else? What about prenatal vitamins? Prenatals are great. They're very hard to break down and metabolize, and most of the products are exactly the same. They usually have the same thing with a different label. Yes, so how do you get rid of that? So you get, the question was, how do you get skin tags? You buy yarrow oil. You can get yarrow plant in oil. You actually put I'm sorry, it's dandelion oil. Dandelion leaf oil, you put it over skin tags, and after a couple months, they fall right off. It's like unbelievable. It's called dandelion leaf oil. Not overnight, but over a period of time, huh? No, most of them, but you have to use it for a long time. Skin tags are like little extra pieces of skin that we get. Just from life. You have one here, you just kind of rub it on that. Thank you, ladies. More next week.